Berlin definition of ARDS. So how to easily memorize this? ARDS, look at the words, acute respiratory distress syndrome. So how can we match with the criteria? Acute, the onset of the acute respiratory distress syndrome or ARDS should be within a week of a known clinical insult. Okay, so there will be new symptom or worsening of the previous respiratory symptoms such as shortness of breath. Respiratory distress syndrome. So there would be something respiratory in the chest x-ray. You will see there will be infiltrates in both lungs, bilateral pulmonary infiltrates, and those should not be due to heart cause, not due to heart, or not due to other lung conditions such as a nodule. There should not be any nodule or an effusion or even a consolidation. So those bilateral pulmonary infiltrates are not due to nodule, not due to effusion, not due to consolidation. Next word, distress. So respiratory distress means hypoxia. And how we estimate hypoxia in ARDS is by PaO to FiO2 ratio. And the ratio is normally above 300. When it falls below 300, this is the mild ARDS, up to 200. When it falls below 200, that is a moderate ARDS. And when it falls below 100, that is a severe ARDS. And in this syndrome, as this is a respiratory syndrome, there should not be any cardiac cause of the pulmonary infiltrate, or there should not be any volume overload, which can also cause the pulmonary edema or pulmonary infiltrate. So you must exclude the cardiac causes and must exclude any volume overload. So in summary, acute respiratory distress syndrome, acute onset within 1 week, respiratory distress, so chest x-ray showing bilateral infiltrates, and distress means hypoxia. And syndrome, you have to exclude the cardiac cause and volume causes, which may be associated with the chest x-ray findings that may also cause the hypoxia. Okay, that's all.